What an honor to be with all of you. And I'm just gonna see if someone could allow me to share my screen, please, because the Zoom is not allowing for that at the moment.
Dr. Cindy, give us a sec. I'm gonna help you right out.
Perfect. That's why I love all these talented technical people that are around us. Oh, there I am. I'm now a co-host. And so we're gonna launch right into it. It is now really an essential time in our history, I think worldwide, as we start to see a real robust discussion of systemic racism taking effect. But within that, sometimes the overlay of colonialism gets lost. And I want to spend some time talking about colonialism before we get into how it really manifests in contemporary society for First Nations children, and then end with how all of you can become a very vibrant part of this pursuit of culturally based equity for First Nations children. So I'm going to begin with this definition of colonialism because, you know, we hear the word a lot, and I think it's sometimes useful to just pause and think about what it means. And this comes to us from Eduardo Galeano, who's a Uruguayan journalist and writer, from his book, The Book of the Embraces. And it says that blatant colonialism mutilates you without pretense. It forbids you to talk, it forbids you to act, it forbids you to exist. Invisible colonialism, however, convinces you that serfdom is your destiny and impotence is your nature. It convinces you that it's not possible to speak, not possible to act, and not possible to exist. It really is the psychology that not only infected First Nations, Métis, and Inuit peoples, it also infected mainstream society. And the way that it really manifests often is about how we normalize systemic discrimination and forms of colonialism in contemporary society. My mother is a very wise woman, and she always said, when you come across anything complex, look for the obvious because almost no one does. And that's really true in terms of the contemporary manifestations of colonialism in Canada. And we see it harder to engage people in these kind of more normalized forms of discrimination and normalized forms of colonialism than we do in the more overt and, I guess, physically present types of colonialism, such as the attempt to put pipelines through First Nations communities, etc. We tend to get some rallying of support there, but when we're talking about systemic racism by the Canadian state, by the provinces and others, that tends to get a little bit less attention, I think partially because it's been so normalized. And another word that's been thrown around a lot is racism. Well, what is racism and where did it come from? And although there is some historical debate on this, a lot of people say that this was the first man to say the word racism. This is General Henry Pratt from the US Army. And you can see here that really he's using the sense of racism in the context of trying to improve the other races. And when he talks about the other races, he's talking about anyone who's not white. And it's not the white folks who need improvement here, it's the other groups who need improvement. And his view was that you had to interact these groups. They had to be interrelating so that the uncivilized, that being the persons of color, would somehow become more civilized like the white people. Now, he actually had another role too. He actually ran the Carlisle Industrial School in the United States. And before that, he was a military prison warden. And so what he did is he took a lot of those things that were part of the military prison system, like giving people numbers, segregating them by gender, doing all that stuff, and putting them on a regimen, and of course, inadequate diet and servitude. He took all of that over to the industrial schools, the American Indian industrial schools. And it was that school that a guy by the name of Nicholas Flood Davin was sent by Johnny MacDonald to go down and see how it worked and see if that was a model for residential schools in Canada. So Flood Davin goes down there. He comes back to see John A. Macdonald. They both think these residential schools ought to be distributed across Canada, and they were. And he's also the founder of one of the most famous statements that's linked to residential schools. And that's this phrase, kill the Indian and save the man. Sometimes we see people say, kill the Indian and, or kill the child, or kill the Indian and save the child, but actually no one has said that in the historical record. It really was kill the Indian, save the man, and that was by General Pratt, the man who founded the word racism. So I think it's really important when we use words that we unpack them a bit to see how they were in their original meaning, and to see whether or not that really focuses in on our conceptions about what we're trying to achieve as distinct and dignified peoples. Another word that I'd caution people against using is Indigenous. I think that that word also takes us away from recognizing the distinctiveness between and within First Nations, Métis, and Inuit communities, and also abrogates Canada from its duty to uphold Section 35 rights for Aboriginal peoples. There's a reason, in my view, a deliberate reason why Canada uses the word Indigenous versus Aboriginal, and that has to do with its obligations under the Charter. So just really think through the type of language we're using and what type of message we're reinforcing. Now let's get to the invisibility question. One of the things that we're all coping with right now, and the reason why this conference and many others are online, is the pandemic. But this is not the first pandemic that First Nations, Métis or Inuit have experienced in Canada, far from it. In many cases, we are veterans at pandemics. And this is one of the earliest situations that happened with colonialism that's rarely talked about when we talk about pandemics. So within the first 100 years of colonialism, and I don't mean the Vikings because they were here first, they came and left, but I mean those who are going to continue to stay, the British, the Spanish, and the French. Over 90% of the approximately 60.5 million Indigenous peoples in the Americas died. Some of that was through willful kind of murder, if you will. Others, it was from warfare, and a lot of it was from disease. And one of the things that this article does, and this was just published, I believe, last year, 2019, is it really was such a marked change in the human presence in the Americas, from a presence dominated by Indigenous peoples, and I use that here because I'm describing the whole collective of Indigenous peoples that existed at that time. Indigenous peoples as sustainable partners with the land. They were of the land, we had sustainable development. When that was replaced with the Industrial Revolution, which was an extraction of everything from the land in order to meet human needs, or it wasn't even needs, it was more human desires, this want and kind of unsatisfied hunger that the Western society had for material goods. And so I think it's important when we talk about pandemics and we talk about the colonialism, that we remember and honor these people who died at such vast numbers and what that meant for the survivors. Because you can imagine if COVID was taking 90% of the Canadian population, how much rich knowledge, experience, contribution would be lost, and what profound grief would be left. Here's another one. We've talked about the COVID exposure in First Nations communities in Canada, and I'm going to get to that more specifically in a moment. But for the moment, I want to turn our minds down south and look at the Native American population. Similar to Canada, Native American reservations are funded by the federal government, the public services there. We don't have reservations in Canada, we have reserves, but the First Nations reserves receive federally funded public services, whereas the provinces do for everybody else. Now, all of us saw the pictures of the folks from the Navajo Nation trying to address, which were skyrocketing rates of COVID-19 on their reservation. And people talked about the fact that only 30% of the community members had water. And that, of course, is a situation confronted by many First Nations. You can imagine dealing with COVID when you can't even wash your hands regularly. But what really didn't get talked about as much as part of this invisible colonialism is the fact the federal government of the United States actually underfunds healthcare for Native Americans significantly. And here we have a comparator group. So the Americans, although they're not very good at all, of course, in funding public health care, they do fund it for federally incarcerated prisoners. They do fund it for persons who are in the armed forces and Native Americans. And you can see here that a federally incarcerated prisoner gets about $6,973 per capita in US healthcare, versus a Native American person who gets $1,297. And by showing you this comparator, I don't want you to mistake that I'm arguing that the federally incarcerated prisoner ought to receive less. I'm actually arguing that the Native American ought to receive more, at least an equivalent, if not more, given the hardships of colonialism on that population. And this is the Morbid and Mortality Weekly Report that the CDC puts out that really demonstrates that Native Americans are 3.5 times more likely to get COVID than whites. So this is an overrepresented population, and they're at further vulnerability for COVID because of the systemic, racial, and I would argue apartheid delivery of services in the US in terms of healthcare and other things. We've also talked a lot recently about the Black Lives Matter movement, and they're to be commended for the important work that they're doing. But in that dialogue, we have not heard much or anything about Native Americans. This is CDC data on the persons who are by race who are more likely to be involved in fatal police shootings. This data comes to us from 2016. And you can see here that Native Americans were the most likely to be shot and killed by police. And yet that doesn't take anything away from the experience of Black or African American persons, but it does say, why aren't we even talking about this? And that's true in Canada too. The limited data that's available shows a dramatic overrepresentation of First Nations, Métis, and Inuit people among those who are killed or assaulted by police. Of course, Black and African and Canadian people are also higher in those margins. But why isn't a joint conversation if the issue is we need to stop police brutality? And this invisible colonialism really has enabled, in my view, this ongoing nature of Canada's discrimination towards First Nations kids. And it's also led us to believe that the government is fundamentally benevolent. So the reason why the government isn't doing things for First Nations, Métis, and Inuit children to improve their well-being is because they don't know better. And so what we will do is people like me who are in academia are asked to do studies to define the problem, or they come to community groups and the feds are usually pretty happy to throw money at a community group to find the problem and maybe propose a solution. The problem with that is that a lot of these solutions have been known for years. The federal government has known about these inequalities. It's not that they don't know any better, it's that they don't want to do any better. And it's not just that they're failing to do it, it's that they're choosing not to do it. And that is at the essence of really understanding the ongoing nature of colonialism. And another piece is to unpack some of the narratives. So right now we're seeing in the Mi'kmaq territory in Nova Scotia, of course, these images of non-Indigenous fishers feeling that First Nations are getting more than their fair share. And that's certainly one of the pieces, the narratives of colonialism. But when we look at what happened to First Nations peoples in Canada, 100% of the land was owned by First Nations and Inuit in 1491. That's a year before colonialism. Now, the First Nations reserves make up 0.02%. So this whole narrative of First Nations being greedy and wanting more than their fair share is completely defeated by the facts. But the narrative is so strong in Canadian society that people don't even think about this stuff. they kind of feel, well, there they go again. They're getting more than the rest of us are. Instead of paying attention to the real and documentation by credible sources, the Auditor General, the Parliamentary Budget Officer, by academics, by you, everyone who has come to see that the problem isn't that First Nations are getting more. The problem is that they're getting less and being judged as if they're getting more. So let's go back to when this started to be known to Canada. And I want you to pay attention to Canada's responses to these things as we go, as you join me in kind of a time warp. We're going to take a journey back about 113 years and come back to today. And we're going to start here with the Evening Citizen newspaper in November of 1907. That's now the Ottawa Citizen. And back in the day, you didn't go to Twitter, of course, to find your news. You went on to the newspapers. And it's really interesting here that you can see on the right-hand side in the red box that the editor was so shocked at what the story was that he put it on the front page in one of the premium and above the fold. So where the newspaper folds, anything above the fold was considered to be a premier news article that newsmakers wanted to share. And you can see here what it's showing is schools aid white plague, startling death rolls revealed among the Indians. And it was talking about a report published by none other than Canada's own Chief Public Health Officer for the Indian Department, Dr. Bryce, who had went out and surveyed the health of the kids in residential schools and found that they were dying at a rate of about 25% a year. And if you followed the kids over 3 years, 48%. In fact, it was totally normal back then to have to walk through a graveyard of children before you got to the threshold of the door of the school, because so many kids were dying in the school that they had to be buried right on site. Now, Bryce found something else. He found, oh my gosh, all the people in Ottawa, the city of Ottawa, are actually getting 3 times more healthcare funding than all First Nations across the country. No wonder these kids are getting sicker from tuberculosis and everybody else. And no wonder they're dying so quickly. So he goes back to Canada and he says, even out the healthcare funding and implement practical reforms like ventilating buildings. Now we hear that now with COVID, right? Social distancing, not putting sick people in with healthy people. All these things were known back then. And Canada refused to do it, even though it only cost about $10,000 to $15,000 of their $100 million budget. And when this thing hit the newspapers, people of the public were reading this and were shocked, including a guy named Samuel Hume Blake, who was a lawyer, later a judge, and said that in the Canada fails to obviate the preventable causes of death, it brings itself into unpleasant nearness with the charge of manslaughter. So I share this because I want people to really also address another narrative of colonialism, which is bad things happened then because people didn't know any better. Clearly, the editors of the newspaper, Dr. Bryce, Samuel Hume Blake, all people of that period knew better. They knew this was a problem, and they were calling out the solution and calling out the government of Canada for failing to act. We're going to go ahead a bunch of decades. But before I do, I just want to point out that Canada, it would be wrong to say that Canada failed to implement Bryce's report. They chose not to implement Bryce's report, and they chose to instead retaliate against him for blowing the whistle on the government. And they tried to push him out of the public service, but he kept talking and kept writing about this, trying to create some kind of movement to address it and save these kids' lives. Unfortunately, he wasn't that successful. And we know from the TRC reports that about 4,000 to 6,000 children, and that's a conservative estimate, died. Many of those children would likely have been alive had the government of Canada listened to Dr. Bryce. So I don't think it's hyperbole for Blake to call it manslaughter, because they clearly knew their actions were creating conditions for which children would die, and they chose to do nothing about it. This is a submission by social workers in 1946 and the Canadian Welfare Council. And this is where we start to see dialogue of residential schools and foster services. And I really want to remind people that in 1895, one of the key reasons why residential schools were set up was not just for assimilation. It was for education, I mean. It was to take care of children that the government felt weren't properly cared for. So that was the early days of child welfare. You would remove these kids and you put them into a white world where they would be properly cared for. Now, what's interesting here about the social workers is they're doing two things. One is they're drawing attention to the inequalities in First Nations public services, or Indian public services, as they would call them back then, and the fact that that needed to be addressed. So good for them, that's what they were doing. A similar message to what Bryce was said several decades before them. But they also supported assimilation, and were quite enthusiastic in that support, and never recommended the closure of residential schools, despite the repeated concerns that were on the record about the deaths and the harms to kids in those schools. So the social workers were stuck in this blind spot where they too thought, well, taking them from their First Nations family and putting them in a residential school, that must be a better thing. They didn't weigh the risk of actually being in a residential school because they presumed that to be a better place for kids. Let's go up a couple decades to Canada's Centennial in 1967. This is a report by George Caldwell. He was a social worker actually at McGill, where I teach. And he looked at kids in residential schools, and by then he found 80% of the kids in residential schools were placed there for child welfare reasons. So one of the things I think that's not that well explained about the 60s scoop is we focus on child welfare, and some kids were being placed in foster care, but at the same time, kids were being placed in residential schools for these very same reasons. So it's important when you look at the 60s scoop and talk about it that you include both. And you can see here on page 149, he is doing what Bryce and the social workers did before him. There needs to be more investment in the community services so that kids can help be kept safely in their families. This is 1967. I would have been 3 years old at that time. So had Canada acted on this, and you can see the report went right to the Department of Indian Affairs, had Canada acted on it, then a lot of the hardships that people of my generation and following generations experienced would not have happened. And that brings us to the late 1990s, after the Royal Commission on Aboriginal Peoples that echoed that same thing. There's these dramatic inequalities. It's leading to hardships across the board. The question is, what are we going to do about it? And we originally worked with the Assembly of First Nations and government and First Nations experts across Canada and did a report that showed the inequalities and proposed a solution to it. Canada welcomed it. Good report, they said. Sent us a nice letter and then didn't implement it. Then they said they needed another report because too much time had passed from the first report. So we get involved in a second report. We involve even more great, talented knowledge keepers from across the country in child welfare, experts, everyone else. We come up with a solution. We get another nice letter from the government. And again, they don't do anything. And here's the crux of the issue, is that in that invisible colonialism, we fall into these patterns of governance that actually perpetuate the discrimination. And one is this continuous thirst of sitting at negotiation tables on equality. And the other is being satisfied with what I call the toxic potion of incremental equality. We're going to give you a few $100 here for shelters or for child welfare or early childhood, but that's still going to fall far short than what you need. But I want you to be grateful for what I'm giving you. And I want you to be patient with me because I've made good first steps towards that. All of that seems okay in real time. The problem is when you step back and you think, what's happening while we're waiting? What happens while we're researching? What happens when we're trying to be nice to them? Is that the impacts are appalling on kids. So what we found is that between 1981 and 2017, First Nations kids on reserve and in the Yukon spent over 78 million nights in foster care. And one of the reasons was that the services most underfunded in child welfare were preventative services to keep kids safely in their homes, the very thing that Caldwell called out in 1967. And when we look at that period when we started doing the reports, 2000 to 2017, well, we're studying those reports, 47,749,267 sleeps of First Nations kids in foster care were going on. So be very cautious when you get involved in these tables. I think it's always useful to work with government to document the problem and address it. But look backwards to see whether that's already on the books, and pay attention to what happens while you're waiting. So we filed the human rights complaint against Canada along with the Assembly of First Nations 2007. It's now been about 14 years. And within a few days, we got all of our funding cut. So we're actually the only national organization at the moment that's First Nations, Métis, or Inuit that has no government money. And that's been rather liberating for us, but it also shows how the retaliation actually works when the government gets hit with a claim. Nonetheless, we were all successful, and that was great onus to the communities and the families and everyone else who was part of this long, hard-fought case. And in 2016, the Canadian Human Rights Tribunal found that the sitting government was discriminating against 165,000 First Nations kids by underfunding these children's services and by failing to implement Jordan's principle. And I wanted to show you one of the paragraphs here, because what the tribunal found is a lot of similarities in Canada's response from residential schools to the 60s scoop up to contemporary child welfare. They always did the same thing. When a problem would come forward, their response wasn't, well, maybe we should think about this. This could be a legitimate issue we have to fix. The response was, let's defer, deflect, or delay. And in large part, I think, one of the things we had to do in that invisible colonialism is step back and think, how do we thwart that? How courageous are we going to be in being a disruptor in the system that continued to perpetuate it? The tribunal also found, and this is important because it's also how invisible colonialism happens, is that if this discrimination was causing unnecessary family separations. And what I remember with that nutcase in the White House south of the border and his egregious treatment of children who are refugees coming up from the South America and Central America and Mexico and putting them in those cages. Canadians were appalled at that. And yet that's exactly what the Canadian government was doing. They were unnecessarily separating these kids. They were also, the other important finding by the tribunal is that Canada's failure to implement the reforms necessary to alleviate the discrimination contributed to the deaths of some children. So that's very similar to what Bryce found and what people like Caldwell found and others through the ages. So this same pattern has been known to Canada for 113 years. And it's only been litigation that's moved them off that. And you might wonder, like with Jordan's principle, which of course is named after this wonderful young boy, Jordan River Anderson from Norway House Cree Nation, who was born in Norway House in 1999, stayed in hospital for 2 years, medically required, and then should have been discharged. Had he not been First Nations, make no mistake about it, there's no controversy here, he would have gone to a family home and been able to grow up there for however long he had. But because he's First Nations, Canada said, nope, not doing it. He's staying in a hospital. I don't want to pick up a cost, the government said, of a provincial government. And then the departments of health and Indian affairs were arguing amongst themselves too. The solution was, from their point of view, to put Jordan in a hospital and keep him there. And Jordan waited that patience argument, that patience speech from the government, 2.5 years before he tragically slips into a coma and dies there, never having spent a day in a family home because he's First Nations. We knew from our studies that this was happening all over the country in different forms, where First Nations kids were being told, no, you don't get that service, or you get less because of your race. So that's where we developed Jordan's Principle with the family, Norway House Cree Nation, the Assembly of Manitoba Chiefs, and the Assembly of First Nations. And really, it's a very simple principle. It says First Nations kids ought to receive the public services they need when they need them in ways that are responsive to their culture. That's it, very simple. Canada adopted it in Parliament in 2007 and then constructed a definition and approach that was so narrow that they made sure there were 0 Jordan's Principle cases. And despite that, a few cases did trickle into the government. And one of them I remember was a 4-year-old little girl who in the Christmas season of 2011 went in for some surgery that went horribly wrong. And it ended up with her in palliative care. Now the request was for a hospital bed so the little girl would not suffocate prematurely. She could be kept at a proper incline to facilitate her breathing. The Canadian government, it went through 15 different public servants before someone writes on the form, absolutely not. Now, you might be thinking, well, did Canada have the money back then? Well, it was running a surplus budget. But even if it wasn't, I think COVID has taught us something very important. Money, they're spraying money everywhere now. I didn't even know they had this much money. So this idea of them not being able to afford it is really a fallacy of the colonial making. The other thing that's important to know is, remember when I keep emphasizing that Canada doesn't just fail, it chooses to perpetuate the discrimination. After they said no to this little girl, they felt that they should honor the staff in the department who are saying no, who are keeping the Jordan's Principle cases at 0. And so they wrote this nomination form to then Deputy Minister Michael Wernick, who himself becomes rewarded and appointed to the Privy Council under the Trudeau government, and asked that these should be a recognition, the highest public service recognition ought to go to this team of people who are working on Jordan's Principle. And they received it. So discrimination in the government was not just something that happened. It was award-winning in the Canadian public service. So thankfully, thanks to the Tribunal, and most importantly, Jordan's family and their persistence, we have Jordan's Principle. And I want to really encourage everyone on the phone to not use any acronyms. It's very important to the family and the elders of Norway House Cree Nation that we use this full name. So it's unfortunate in the 1-800 number that I had to use an acronym, but it was to do with the Jordan's name already been taken up by the telephone numbers. But here's some key points. Jordan's Principle applies to health, education, and social services. Jordan's Principle only requires a note from a professional or an elder in order to access those services. And in BC, what we see is the lowest, by far the lowest rate of access on Jordan's Principles in British Columbia. And the lowest rate of approvals and the highest number of denials are coming out of that region, and that's something we're trying to do. The other thing is you can apply for individual or group cases, and if the case is urgent, you as a professional feel that the child would be suffering some remedial harm if it's not addressed within 12 hours, then say it's an urgent case when you call this number, and that requires the department to address it within 12 hours. So Jordan's Principle has now yielded over 250,000 services and products for kids last year that they otherwise would have been denied. And the vast majority of those are just services other kids got as a matter of course. So it shows you how deep the inequality is. Another important point about Jordan's Principle is that because First Nations children have been shortchanged for so long, it allows for substantive equality. What do I mean by that? I mean that you can apply for a service that may not be available to other children in the province, but it is necessary to give that First Nations child the same opportunity to succeed and live a life of dignity as other kids. So this is an important tool and toolbox, and I really urge folks to learn more about Jordan's Principle and to work with your families in order for them to access these services that they ought to be accessing. And I thought I'd include this because I kind of, through the 14 years of litigating against Canada on this case, I noticed some patterns. And I wanted to just share those with you and see if your reflections are somewhat the same. So Canada perpetuates systemic discrimination by using words like it's too complex, be patient, incremental, can't change overnight. They disregard First Nations experts. They codify inequality at the family or community level. So they're usually very happy to pay for parenting courses, but not for to deal with the poverty or the inequalities in services that drive that parental risk. The other is they dehumanize children and families, and that's why acronyms are so dangerous. They really do that. If you call it an acronym or a file or a program, that's dehumanizing the actual impacts of it. And it's so important that we try to avoid that. They would defend versus appraising critique. So like I said, when something came in, didn't matter if it was Canadian Medical Association, Auditor General, First Nations expert A, or First Nations government, the reaction is always the same: rebut and try to spin it so that it's something positive for the government. And that's still an ongoing problem. You'll find on the Government of Canada's website about the tribunal, they put the orders, but then they call the monies they were forced, and I do emphasize that. They never voluntarily provided money for the tribunal. We had to litigate. They call it investments that they made, and they'll often use that in their PR instead of really sitting with the discrimination that they caused and being accountable for it. Mistaking process for outcome. This happens a lot with inquests, inquiries, research projects that don't materialize in real change for people. So measure real change at the level of the children and families. And overstating or diminishing First Nations involvement. They use the word engagement all the time, and I've been trying to push them to find out what that means. And ask why they're not using consult. Ask why they're not using rights. Why they're talking about partners as if we're somebody just in the general community versus self-governing nations and those kinds of things. And they reward conformity to bad ideas. And that's what we saw in the Jordan's Principle piece. So this is the study that we talked about with the Pan American Health Organization. And what we did here is we received the knowledge from a lot of wonderful people all over the Americas. And the report looks at the questions of equity, particularly from the experience of Indigenous peoples and persons of Afro descent. And what we did in the model of this particular one is we recognize the land as a determinant of health and recognize the type of systemic discrimination we saw at the tribunal as being a deterrent to the achievement of a dignified life and as part of the determinants of health model. So you can find this report in French, English, and Spanish on PAHO.org. And I think equity is really undervalued in a lot of these caring professions because really it's the closest thing we have in evidence to a silver bullet. If we reduce the inequalities in our own society, the benefits are broad sweeping for the group that was disadvantaged. They're more likely to graduate from high school, less likely to be poor, more likely to have trust in neighborhoods, less likely to go into child welfare, less likely to have health problems. The data on this is very, very strong. And so everyone should be linking whatever they're doing to this equity pledge. In child welfare, what we're doing is we're actually trying to switch the model using the funding. And we've decided that in order to do that, we needed to ask ourselves a different question, which isn't how to keep First Nations kids safe. It's how do we enable First Nations children to thrive? And by asking that question, we get at those structural discrimination issues and colonialism issues that need to be remediated to give First Nations families a good opportunity to succeed. And this is a report we just came out with. And despite the fact that the child welfare funding has doubled since the tribunal, we've had all these gains with Jordan's Principle, although they're still not fully compliant. You can see here that the low estimate is that the government is still underfunding the program by about $567 or $570 million. That's a lot of money. And that's only in one program. So if we look at Jordan's Principle and CFS, right now they're spending about $3.2 billion more than they ever did before. And you think about the Kelowna deal for $5 billion, and you can see how much that would have fallen short. The inequalities across all of these programs are dramatic. and are experienced that way by the community members. Which brings me to the Spirit Bear Plan, which is a solution to this. In all the years of the government, no one has ever had forced an evaluation, an independent evaluation on Indian affairs. No one said, why is it that you don't do better when you know better? And so we're calling for not only full implementation of the Canadian Human Rights Tribunal orders, but an independent 360 evaluation of the department to find out why it doesn't do better when it knows better. And that would affect all kinds of things, land claims, everything else. All these solutions are piled up at the door of Indian Affairs, and no one is opening and allowing opportunity to flow through. Why? We need to find out. The second thing is, let's cost out all the inequalities. Instead of just dealing with them bit by bit, let's cost out all the inequalities affecting First Nations children and families, and develop something like a Marshall Plan and address them all. And this ought to be done with dispatch. Again, COVID has shown us they've always had the money to remediate these inequalities. The government of Canada has chosen and continues to choose not to do it. So we, the people of the public, the people of this period, need to demand an end of this apartheid service regime. Because equality for children, as you know, needs to come in a leap, not in a shuffle, particularly given the critical stages of development that they're at. We've also been doing a lot of work of engaging children in knowing about what these structural issues are and engaging all children of all diversities and the solution to remedy them. And we just finished in partnership with Spotted Fawn Productions, which is a Indigenous firm, animation studio in Vancouver, a reproduction of a story that I wrote called Spirit Bear and Children Make History. And it tells the story of the Tribunal and Jordan's Principle. It was premiered at VIF to 2 sold-out audiences, and it features the voices of a lot of the children who were actually at the Tribunal, as well as the wonderful Mary Tiji from Carrier Secondary Services, who gave me Spirit Bear, the stuffed bear that you've been seeing, who has become our ambassador and our mascot for reconciliation. So you can find out more about this 25-minute film, and Amanda's artistry is just amazing to be able to share in your communities and within your professional groups by contacting us. So I think I'll leave it there. I just want to say to you that the Spirit Bear Plan is one of only 7 ways that we have on our website that you can make a difference. And we have a whole pile of other materials as well, including things like child-friendly versions of the Truth and Reconciliation Commission, calls to action, all kinds of free resources that are available to you to become an actor in addressing systemic discrimination so that another generation of First Nations, Métis, and Inuit kids don't have to recover from their childhoods. So I hope that was helpful, and I'd be more than happy to take any questions.
Thank you so much, Cindy, for such an amazing presentation. There were so many take-home quotes for me that I was furiously writing down. One of the questions, or one of the things that really resonated with me was when you said, what happens while we are waiting and doing the research and negotiating, is that, you know, the impact can be devastating for First Nations children. So I wonder if you have some recommendations for us as people working within healthcare on, you know, how we can ensure that we're taking immediate action on some of these things and how we keep ourselves accountable to moving things forward, not in a shuffle.
Yeah, that's a really good question, Brittany. And I think one of them is being aware, as First Nations organizations, Métis or Inuit organizations, one of the things that I think we could do a better job of sometimes is just packaging what those to-dos are for the general public. And that was a learning that we had at the Caring Society. I'd often go out and describe the inequality, but I wouldn't have a very clear path forward for the average citizen to get engaged. But we've rectified that with our 7 free ways to make a difference in under 2 minutes. And we really wanted to make them free, Brittany, because one of the things that really is important to me is I don't want people's citizenship to be measured in the amount of money they make. I believe in the dignity and capacity of every person, regardless of income, to make a contribution to positive change. And when organizations and NGOs just ask people to donate or do fundraisers, a lot of people aren't able to do that. So we've really made these ways free and accessible to everyone. And when I mean everyone, I also mean children. I think that one of the things that children really taught me, and I started out doing work for children. Now I do it with children, and actually I stand behind children, because children are such wonderful teachers about advocacy. You know, I live here in Ottawa, and I walk by Parliament, and during normal times, we see protesters out there, adult protesters, and often they're crying or they're yelling. And what the children have told me, and what also the elders across the country have reinforced, is that social movements have to be based on love. That doesn't mean that we don't trust one another. We need to love one another to trust by saying the truth. But the actions we do together have to be nested in that concept of love, that only sustainable movements can get to that place. And that's why a lot of what Spirit Bear does is very fun and engaging, because you can be happy about changing the world in a positive direction while acknowledging the stark truth and the traumatic impacts that actually exist there. The third part comes to how courageous are you? You know, in our various professions, we slide by talking about advocacy a lot. And we say, oh, I have a great, so-and-so is a good advocate, or I'm an advocate for this person. And those words are easy to say when we don't talk about what are we prepared to personally and professionally sacrifice. And there's this whole school of thought called moral courage. And what it is it says in Western society, when we have when someone's physically courageous, I jump in front of a car to save somebody, then I'll get a medal around my neck. That's something to be rewarded. But when someone says something or does something in a moment when others are being treated badly, we often punish moral courage. We punish that person. You're rocking the boat. You're gonna, you know, look, that wasn't such a big deal. We have all these ways of punishing people. But in professions, it is our job to stand in the winds of discrimination for people that will never know to be thankful to us. So how do we develop that courage in ourselves? And there's a great YouTube channel called Moral Courage that has two-minute vignettes of people of all walks of life who have been morally courageous. And really what I like to emphasize to people is just make the conscious decision when you're being a moral coward. We all know what that feeling is inside of us. Ooh, gee, you know, I just saw that, that's not right. And then we get in this internal dialogue. Well, what am I gonna do about it? Well, what if he says something to me? What if you know, then there are some breakthrough moments when we're in that moment of confusion, is what am I gonna do about it? What we're often doing, if we're really honest, is weighing what the implications are for us. Right? When it really gets down to it. Because always the right thing to do is to stand out and stand with that person being persecuted. Even if you fail, you've succeeded in showing them that you love them enough to care for them. Right? And so we have to kind of monitor ourselves and when we're moral cowards and when we're morally courageous, and really program ourselves out of that normalization of allowing ourselves to be moral cowards more often than not, and really saying, okay, this is what I learned this time by being a moral coward, and I'm going to ramp it up next time, and I'm going to try and do better. And the other thing that has is a big payoff for the person who's being morally courageous. Because I don't know about you, Brittany, but there's been times in my life when I've been a moral coward, absolutely. And what happens is I think I let myself off the hook on the short term, but then I'm kicking myself for 2 to 3 weeks, often longer than that, downstream. And when I actually do something that's morally courageous, I actually feel pretty good about myself. It's like, whoa, I actually did something like that. Good for me, right? This is what the elders have been asking of me. And so I say it's also important for your own wellness. If you're acting with moral integrity, you're going to be able to live better as a whole person. And you're not going to be reaching for every self-help book or going to too many yoga classes. You'll be able to get by on bath bombs and cheesies like someone like me.
Thank you so much, Cindy. I think that this is such an important dialogue around moral courage, and especially when, you know, there are people who are trying to shift systems to being more culturally safe and more supportive. And what would you say for those who are maybe in the journey of developing their own moral courage and, you know, may have some fear of repercussions due to speaking up about some of these injustices?
Yeah, and you know, and I'm not here to say that being a moral coward is always a bad thing. It is, though, that we have to practice it, right? So that there are times even now when I know I'm crabby and I just really can't deal with that person in a good way that would, you know, really make a difference. And so sometimes I let stuff slide, but make it a deliberate choice and keep practicing, because people often think, wow, you know, I won't be called on in my lifetime, or no one's listening to me, or I can't make a difference. I know that people feel that way because that's exactly how I felt when I started out. I felt like there had to be somebody else out there who could tackle these inequalities way better than I could. And I just held on until that person appeared. And that was a cop-out on my part, really, right? And I had no clue what I was going to do. But what I found is when I finally got over myself and actually stepped in there, petrified with my stomach just hitting the floor, that there's other people there on the other side who are there to help you, right? You are only alone to the degree that you feel you're alone. And I realized that it wasn't just the people in the present. It was these people like Dr. Bryce who had come before you, right? All these ancestors who had stood up in strength. When we stand up in strength, we stand in their company, and we just got to reach out for their help and they'll be there. And the other thing is, when I remember when I was younger and I would say something that was morally courageous, I guess. And people would say, well, when you're older, you'll figure it out. And sometimes they were right, actually. I was just stupid. I was just kind of not thinking things through and being disciplined. But there were some times when they were wrong. And I think what I did is I let the message from the naysayer be my future, instead of being a signal for me to think through more about what I was saying and doing, and really evaluating whether it was actually in the public interest. Was I actually doing right, or was I more trying to be right? And that helped me, that kind of, okay, I want to do right versus be right. I want to practice my moral courage. And eventually you end up in a position where someone is going to listen to you, and someone's going to be that, you're going to be that person in a company of change makers. And there are great groups, like if you get into big trouble like I did, you can reach out to a group, and I'll put it in the chat. It's called Frontline Defenders, and they have a great website. Everybody should check it out. And it is a organization that protects human rights defenders and has all kinds of resources for you so that you can actually hone your skills at being a better advocate and to protect yourself.
You know, whether you know it or not, Cindy, I think you're giving a lot of people inspiration to seek out and draw upon their own moral courage right now. So,
well, that's good. I think we all need it, right? And especially when we're dealing with little kids, right? That's something for me. I don't know how you found it, Brittany, but I am always so in awe of how much dignity and courage little kids have, right? Yeah. And I think when I get crabby, or I got afraid, or I continue to be afraid, I just think of what would it look like if someone like me is under my desk while a 4-year-old is trying to courageously get a clean glass of water and try to learn as best as they can. I don't want to set that kind of example, right? I got to have at least as much guts and as much dignity and as much love as that 4-year-old.
Yeah. One of the questions that popped up, Cindy, was that, you know, for many years, we've seen the devastating impact of First Nations, Inuit, Métis youth suicide. Yeah. And it's undeniably connected to this colonial history and to children's experiences in child welfare. So What are some of the recommendations that you have around addressing that? And specifically, what would the health system's role be in that?
I think one of the things we have to do, and that's what we're trying to do with Spirit Bearers books and animations, is actually teach people that the services on reserve are unequal. And that's what makes life hard for First Nations youth, harder than it ought to be. Because what happens is that these kids are growing up on reserve, and everybody on reserve is trying to make do with what they have, right? There isn't this kind of like, our school's getting 50% less than everybody else is getting, right? And so what happens is for kids on reserve is that they tend to internalize this discrimination. They start to think, oh my gosh, I turn on YouTube or TikTok or whatever, and life is so much better for them. It's so much easier. So it must be me. I must not be smart enough. I must not be good enough. I must not be caring enough. I must not be worth the money. And those messages get codified into them. So what I try to do is say, no, you know what? You are worth the money. You are really special and you are really sacred. And the reason that things are harder for you is because you're getting less than everybody else. But we're going to involve everybody in making that better. And here's how you can help too, right? Engaging them in it and trying not to codify it. I think that's important. That has to be an important ingredient while you offer things like mental health services, etc. Because if you don't help the youth tease out what are the actual hardships that they're facing that other youth don't, then they're going to take it in personally and think it's all about me and how I'm not good enough. And we don't want them to leave with those messages.
Yeah, so internalizing that systemic discrimination.
Yeah, and really keep your eye, if you're going to be doing interventions for young people in suicide, and look at the great website, by the way, of Youth and We Matter. That's a great resource. Started by youth to respond and prevent youth suicide among First Nations, Métis, and Inuit. But keep your eye on those inequalities. If you don't address those inequalities, we're not going to see meaningful reductions in the tragic youth suicide rates that we're seeing across the country.
Yeah, another question we have, Cindy, is do you have guidance for how to navigate systemic racism when working as a social worker in an acute care setting, especially in an emergency department where the culture can be discriminatory towards Indigenous people?
Well, we just saw that playing out in Quebec, didn't we? With that very, very tragic case of the nurses making those racial slurs and derogatory statements before that poor woman who was passing away. I think that there's a lot of need for reform in those areas. I think what you can do is, there's a book actually by one of my friends, is Dr. Samir Shaheen Hussein. I can put it up there. It's the I can't remember the title of it. I'll find it. And it's about colonialism and medicine. I think arranging even talks like that during grand rounds and other professional development is useful. And make sure that you link them to actual things that they can do. If you just educate people without equipping them with a chance to make a difference, then I don't think it gets internalized in the same way. And it's not about saying that, you're all bad people. It's about saying that colonialism actually infected you too in a negative way. So it's not, and that's why I'm against the word healing. I don't use that word. I call building on multi-generational strength, because I think that strength is stronger than any kind of trauma that Canada foisted on us. But we need to address that in the non-Indigenous population, that they too were affected by colonialism, and that deprived them of being able to do better when they know better. So our opportunity is to make sure they know better so that they can choose to do better. And if they choose not to do better, then that's where the professional colleges need to hold these people to account.
Amazing. Another question is that how do we start to build supportive cultures within workplaces so that people who are enacting their moral courage might feel less alone?
Yeah, I think that really one of the things I'd like to do is really talk, like here at the Caring Society, we talk about it all the time, and really normalize that as part of the discussion. And really, so when there's workshops on advocacy, have a workshop on moral courage, right? and really talk, because a lot of people, everyone struggles with this, right? We've all been there when we should have said something and we didn't do it, and then we feel terrible. And if we talk about, well, how is it that we can help build our skills so that we're more apt to speak out in those moments when a voice is really needed, to stand up when others want us to sit down. And so I really think that there's a lot of great resources on YouTube on moral courage. I've done some writing on moral courage, and I really recommend that that be part of your professional development. I think it should be before you talk about advocacy, because unless you got the moral courage, the advocacy tools you'll be taught won't go anywhere.
Thank you. Are there any take-home points or more information that you can give our audience on Jordan's principle and what happens when it isn't honored?
Yeah, it's a good question. Well, we're still at the tribunal on Jordan's principle, and we can put things called non-compliance orders, motions before the tribunal on Jordan's principle. We have done that. They have been successful. Most recently, we've been able to expand the definition of Jordan's principle to include First Nations children off reserve who don't have a status card and aren't eligible for one. We wanted to get away with the Indian Act definition. That order hasn't come into effect now because we have to just do some final submissions on it, but that should be soon. So if you're noticing a systemic issue where children are being denied and Jordan's principle is not being adhered to, then please let us know at our office, and we keep track of that to try and hold their feet to the fire. The other thing is you can find out a lot of information about Jordan's principle and the evolving orders on jordansprinciple.ca, and I'll put that on the website here. And our staff are always really open to providing information. We have lots of information sheets on there. And of course you have Spirit Bear's amazing animation that you can view in your organizations, in your hospitals and other areas. It's a great jump off point for discussion.
Cindy, I really liked how you spoke to some of the dehumanizing language that can be used when we are discussing some of these inequities. And I wonder if you can speak to that a little bit more in how we develop our policies and approaches, and how we can be really mindful of the role of language in that.
You know, one of the things Spirit Bear was gifted to me by Carrier Sekani Family Services by Mary T.G., who's the voice of Mary the Bear in the animation. And I had gone to her for some advice about this litigation, because as I told you, when we filed it, it was like, oops, now we filed it, what do we do now? Like, I didn't have a clue. And so I was going around panicking, talking to people, finding out what the next step should be. And she gave me this teddy bear. So I look at him, he looks very cute, but he doesn't know, like, he knows a lot about the law. And I'm thinking, you know, okay, I guess we'll take him, you know. But he was actually essential to the case. He was the exact thing that I needed to have in that room, and it gets to your point. He represented all the children. And so I started bringing him to all the hearings of the case, not only to remind everybody else why we were there, but to remind myself why we were there. And to, in every moment, use it as an opportunity to humanize the impacts of this discrimination. And to not call it something friendly, like, well, you know, this is a first step in a government's kind of plan to address some of the vulnerabilities of First Nations. No, this is racial discrimination by the Canadian state. So having Spirit Bear there, and I recommend everybody get themselves a teddy bear, will remind you to not use that kind of language. And to actually, one of the things I find helpful is sometimes to keep a notebook of the types of words that we always use. And then I stop and I think, well, what does this actually mean? And when I say it, is it easy for me to say if it's describing something horrible? Like, I don't like the word overrepresentation in child welfare because it's too easy to say. Right? I can say it and I don't even get an emotional reaction. But when I talk about how many sleeps away from their families and away from their brothers and sisters and their pets and their lands that First Nations kids have spent, that brings an entirely different emotion. And for those of you who are trying to frame social justice change, I really recommend you read the book, George Lakoff, Don't Think of an Elephant. And it tells you how to share things in a way that really evoke the humanity of the situation. And to be able to share what you're trying to achieve in a way that other people can relate to.
Amazing. You know, what advice do you have for those in the audience who, you know, are warriors for equity and, you know, fighting for, you know, Indigenous children and youth and people within the healthcare system for, you know, keeping themselves healthy, keeping themselves well in doing this tough work?
You know, I think for every person it's different. For me, having that moral courage to live my life with integrity is important. Some of you may know that during the long history of the case, the government at one point was seriously retaliating against me. They were following my personal movements. They deployed just about 200 people to follow me and follow my online stuff. And it was not a pretty situation. In there, you start to feel fear. You feel fear about what they're doing that you may not know about. And in my case, my 17-year-old nephew was living in the house, and so I was afraid for him. And then I stopped. That was actually a gift from Canada in some ways, because I stopped myself and I thought, what is it really as a person that I truly value? Is it my house? Is it my car? Is it the far too many coats I have in my closet? Like I love vintage, so you can find me at vintage stores all over the country, and I got tons of coats. And I decided none of that stuff really mattered at the end of the day. What mattered to me was my values and my relationships with others, living those relationships with others and keeping with those values. And it struck me then that only I can give away those values. No one can take them from me. And when I realized that, that became a very liberating moment, because I realized that as long as I had the moral courage to act with dignity and to not, as Michelle Obama says, go high when they go low, then I had nothing to be afraid of. And so this whole moral courage thing and this being in touch with my values and giving them primacy over my life has given me enormous freedom and enormous relief. And so I don't have to do much self-help. I'm pretty happy just kind of just chugging along, because I pay attention to that calibration of how well I can live in that moment. The other thing is for me, is that I really pay attention to something called The Element, which is Ken Robinson's book, The Element. And what it is it says that every one of us has a gift. And the gift isn't just something you're good at, because I happen to be good at some things that I absolutely do not like doing, like management. I do not like management. I'm pretty good at it, but I don't like it. It's when you're good at something and passionate about it. And curiously, it's often the thing that you're most afraid of in yourself, the thing you hold back from other people. So in my case, I come from the Scared Stiff School of Public Speaking. I was absolutely petrified of public speaking. I transferred out of any course at university that said public speaking. And that turned out to be what I was able to contribute. So by giving my element in all parts of my life, then I feel like I don't have to worry so much about the work-life balance, because I feel like I'm giving the best of myself, or at least trying to do that on a daily basis. Some days I fall flat, but at least I try.
Thank you so much, Cindy. I think that you know, I could continue this conversation all day with you. So I want to wrap up and thank you again for your presentation, for inspiring us to call upon our own moral courage, renewing our passions for justice, and thank you for continuing to fight for children and youth that so need it.
Well, and thank you, Brittany, and thank you to everyone who's on the call, and to those wonderful interpreters who are bringing a message to everyone so they can engage in these 7 free ways to make a difference. I wish you all good health and a good journey forward, and lots of moral courage. Get into lots of trouble for doing the right thing.
Thank you so much.